The FDA says Moderna's COVID-19 vaccine is 94% effective at preventing symptom illness and likely prevents the spread of the virus.
The FDA will likely take steps to approve the vaccine for emergency use by the end of the week. And paired with the Pfizer vaccine, experts believe 20 million people will be able to get the vaccine this month.
Here to talk about that and other COVID-19 headlines is Dr. Jeff Pothof, Chief Quality Officer for UW Health. Doctor, good to see you again.
Hi,
Good
Dr.
to see you
Pothof.
guys too. Hi.
We have light at the end of the tunnel. It must be a pretty exciting time over there at UW.
You know, there's more smiles on our faces at UW Health here today. A lot of our providers, our frontline workers, they're giving each other high fives. This has been, long in the waiting to have a vaccine that will ultimately, close the book on COVID-19. So, yeah, it's good times right now.
It is such encouraging news, but what is your message to people about where we are with the pandemic right now? We're about 10 days away from Christmas.
I think it's really important to realize that with some optimistic data, both on our trend line in Wisconsin, cases decreasing a little bit, hospitalizations down. On the other side, this vaccine news, that's really great. But I don't want people to think that this is over yet. There is still a tremendous amount of COVID-19 in our state. There is still a lot of suffering and a lot of people dying from this disease. So we do need to toe the line for just a few more months. We have to be masked. We have to socially distance. The game's not over yet, but it feels like the end of this is in sight.
People have to get vaccinated with like 70% to make this effective?
Somewhere between 70 and 80%. If that percentage of the population were vaccinated, it would be very difficult for COVID-19 to pass freely amongst us. That would basically be that artificial herd immunity from the vaccine. That would just be a great thing to see here in the United States.
Well, you were very brave and took part in the AstraZeneca trial at UW Hospital and got that vaccine. That's not the ultra cold one, right? What is the difference between the three vaccines? And if you're receiving one, will you know which one you're getting?
There's a good chance you'll know which one you're getting. What I would tell people is don't worry so much about which one you're getting. Just ensure that you can get one. The technology used for the Moderna and the Pfizer vaccine with mRNA requires much colder temperatures, which make it a little bit more difficult to transport it. The AstraZeneca and Johnson & Johnson vaccine doesn't use that technology, so they don't have to be as cold. They basically have to be refrigerated. And you imagine that makes it a lot easier for hospitals or other parts of the world where this ultra cold freezing becomes really difficult to do.
But it's going to be a while before healthy adults get this vaccine.
Yeah, with the way that production's ramping up, I think, on the optimistic side, probably late February, more realistically March, before we had wide availability where someone can say, you know what, today I'm going to get my COVID vaccine, go to a pharmacy, go to a clinic and just get it. That's probably a few months out yet.
How soon do you think all of the healthcare providers at UW Health will be vaccinated?
Yeah, I know that we want to get through our initial supply for sure by the end of this year. Hard to say for sure when everyone will get vaccinated, but we really realize that there's really no point in having vaccine frozen in a freezer. So as soon as we get it, we're trying to get it in the arms of people so that they can be protected and then by extension help our community because our healthcare workforce is healthy.
And we need to emphasize that the vaccine is safe. They wouldn't be approved if they weren't.
Right. It's an independent advisory group made up of scientists who aren't affiliated with the government. They don't get any kickbacks. They evaluate whether this is safe or not. The world scientists are looking at this too. These vaccines, despite being made in record time, I know that causes a lot of pause for some people. The data points towards these being safe and highly effective.
Well, 2021 perhaps will be a much better year than the one we've just been through.
Yeah, I sure hope so.
Doctor, thanks for being with us today. Valuable information as always.
Thank you for your time, Dr. Pothof. Great to see you.
Thanks.